Hi, my name is Dr. Alina Fong, and I am the clinic director at Cognitive Effects, and I'm also one of the founders. And I have been asked by some of our patients and some people that are interested in coming to Cognitive Effects who have read our blogs that sometimes it's easier to hear an audio version. And so I'm going to be reading some of our most viewed blogs, and today I'm going to be reading about concussion symptoms, causes, and how long they last. Concussion symptoms can be confusing. They don't always show up immediately. They can come and go, and they don't always go away without treatment. We treat concussion patients every day and answer these questions for our patients regularly. That's why we've put together a guide to concussion symptoms, including what symptoms can appear in adults, teenagers, children, and toddlers, the types of concussion symptoms, the long-term and short-term effects of a concussion on the brain, how long common symptoms typically last, why symptoms of a concussion might be delayed, and information on concussion recovery. In case you're in a hurry, we've also put together this signs and symptoms of a concussion checklist, which you can see on the actual blog itself. If you have any of these symptoms on this checklist, combined with a known head injury, you could have a concussion. Symptoms of a concussion. The top 10 concussion symptoms are brain fog, lack of focus, headache, memory difficulties, fatigue, irritability or nervousness, mood disruption, light or sound sensitivity, sleep problems, and a change in your quality of life. We've categorized these concussion symptoms by when they typically appear. Symptoms in the immediate or early column are often observed earlier than not. But the symptoms in the second column, which is early or delayed, may appear early but are often noticed later in recovery. Please refer to the table in the blog for this information. If you're having balance problems, make sure you're in a safe environment and that you have a loved one with you if possible to keep you safe until they resolve. Memory loss is uncommon outside of brief amnesia associated with the event that caused the concussion. If you experience more than just mild short-term memory loss, please consult with a medical professional. Symptoms that are more dangerous, but which still do not necessarily constitute an emergency, are usually weakness or decreased coordination, repeated vomiting or nausea, and slurred speech. Sometimes head injuries cause startling, more severe symptoms. If you experience any of the following symptoms, get medical attention immediately. So, go to the emergency room if you, 1, are increasingly confused, restless, or agitated. 2, you can't recognize certain people or places. You have pretty significant disorientation. 3, you exhibit strongly unusual behavior like impulsivity or dangerous decision-making. You're making odd or illogical statements. You are drunken in appearance, etc. 4, if you're having convulsions or seizures. 5, you have one pupil that is larger than the other, or you have pupils that do not respond to light. 6, experience excessive drowsiness or do not waken. Or 7, loss of consciousness. These are symptoms of a serious brain injury and necessitate immediate medical attention. Now, for notes on symptoms in teenagers. The list of concussion symptoms for teenagers is the same as the symptoms in adults. However, parents often ask us how to tell the difference between adolescent angst and concussion symptoms. And here is our rule of thumb. If the behavior or complaints you observe in your teen are at all unusual for them, assume it's the concussion. While some symptoms like irritability, depression, or anxiety may come from other sources, it's entirely possible that they are from a previous concussion. So trust your parental instincts, and when in doubt, pursue treatment options for a concussion. It may be that they won't feel better until they receive adequate medical care. Now, for notes on symptoms in children and toddlers. Many everyday activities put young children at risk for concussions. And try as you might, it's not always possible to prevent every situation that could lead to head injury or trauma. But it's harder to know if they have a concussion since toddlers can't always tell you exactly what's wrong. They're still learning how to understand and express what they feel. If you witness your child fall and hit their head or otherwise take a blow to the head, keep an eye out for symptoms and consider seeking medical advice. Nearly 50% of all traumatic brain injuries in children come from falls. You can find more information at the CDC, or the Centers for Disease Control, at their Heads Up website, and there's a link to that website in the blog. Common causes of concussion in children include falls, sports injuries, fights, or collisions with other children, as well as physical abuse. Some clues to symptoms. Children may behave in ways that help you know if they're experiencing a concussion. Signs of pediatric concussion include these behaviors: angered easily, appear dazed, crying more than usual, a change in their behavioral patterns around food, exhibit new sleep patterns and behaviors, losing their balance more frequently, or they might seem more unsteady. They might seem unusually tired. They might seem uninterested in favorite toys or activities. And they might touch their head a lot, maybe to indicate that it hurts. Children in sports can visit a concussion clinic at the start of the season for baseline testing. If they sustain a possible sports concussion during the season, then retesting may help establish that a concussion has occurred and help indicate which skills were affected. And importantly for children, go to the emergency department if you know they bumped their head or experienced shaking or jolting, and 1, they have any of the emergency room worthy symptoms listed for adults. 2, maybe they just won't stop crying. And 3, they refuse food or nourishment. Ultimately, if there's any question as to whether your child is suffering from a concussion, it's always better to have your child's doctor check them over than to assume nothing is wrong. Types of concussion symptoms. Sometimes patients are given a concussion grade based on the severity of the circumstances around their concussion. But often these grades fail to predict the severity of symptoms or how long they last. A study from January 2020 published in Neurosurgery offers a different way to think about concussion symptoms. People who have a concussion will often experience symptoms from more than one grouping. First is vestibular symptoms, so symptoms related to balance like dizziness, trouble balancing, and nausea. Secondly is ocular motor symptoms, or symptoms related to vision and movement like blurry vision, double vision, and difficulty reading. Third is headaches, and you can actually learn more about all these post-traumatic headaches in a link in this blog. Next is cognitive symptoms, or symptoms that relate to how you make decisions, how you process information, brain fog, memory problems, concentration and focus issues, and even word finding or word retrieval issues. And then lastly is mood-related symptoms, or symptoms that affect how you feel, such as anxiety, depression, irritation, and feelings of being really overwhelmed. Knowing which types of symptoms you're experiencing can help guide your treatment plan. Effects of a concussion on the brain. A concussion is synonymous with the term mild traumatic brain injury, or MTBI. Remember, you don't have to receive a blow to the head in order to have a concussion. A concussion may occur whenever you receive maybe a bump or a jolt to the head, or shaking of the head, or even a hit to the body that can cause the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. And this definition came straight from the CDC. If your car stops suddenly, for example, there's a chance your brain could be jarred enough to hit your skull and or cause whiplash, even if you're wearing a seatbelt. That jostling is enough to cause symptoms. Short-term effects of a concussion on the brain. In severe traumatic brain injuries, you might incur physical damage to the skull and brain. But a concussion, by definition, means you have not suffered severe physical damage. If you have a concussion, you suffer from the effects of a mild traumatic brain injury, or temporary damage to brain cells, popularly called bruising, contusions, swelling, and inflammation. Inflammation is the body's natural response to an injury. Blood and other fluids rush to the site of the injury so that the body can effect repairs. Brain swelling can result from this process. During normal brain function, your brain calls for increased blood flow to deliver oxygen when and where it's needed. This is a relationship known as neurovascular coupling, or NVC. For example, if you're reading a book, then the parts of your brain governing sight and reading comprehension would call for increased blood flow. That gives your brain the energy it needs to help you perform those tasks. If inflammation and cell damage from the concussion interfere with the signaling between cells and blood vessels, you might struggle with certain tasks. For example, if a brain region governing attention cannot get the right amount of nutrients and energy at the right time, you might struggle to follow a conversation or find yourself unable to focus for more than a few minutes at a time. If other brain regions try to help, they have to work harder in order to compensate to complete the same task. In other words, communication between neurons along the original pathways is disrupted because they don't get enough oxygen, among other things. As a result, you may experience any number of concussion symptoms. In an ideal recovery, the brain will resume using the most efficient pathways to deliver oxygen, glucose, and information. But that doesn't always happen and not always on its own. Long-term effects of a concussion on the brain. Sometimes the brain doesn't return to using the most efficient pathways. Instead, it may continue using the less efficient pathways formed during rest and recovery. In most cases, the number of pathways affected is not enough for you to notice a difference in your day-to-day life. If it is, you might experience persistent post-concussion symptoms, also known as post-concussion syndrome or PCS. Some people develop PCS after just one concussion. Others develop it after a second concussion or even multiple concussions. That's because the more concussions you have, the more opportunities your brain has to solidify suboptimal or less good ways of sending information and getting oxygen. Those changes can be responsible for everything from headaches to mood changes to forgetfulness. Now, think about suboptimal signaling pathways in your brain, like the different routes you can take to commute home from work. Some roads have more traffic than others. If you have to route around an accident, you'll take longer to get home. And if you get stuck in traffic, who knows how long it will take? In those situations, you end up tired and frustrated because what should be an easy trip home is not. Now, during healthy brain function, communication traffic would be equally distributed along existing roads. Suboptimal pathways are like getting stuck in a traffic jam or having to take the long way around. Those cells are unable to call for enough oxygen to do their jobs, so other cells have to do it. The more that happens, the more tired your brain becomes, and the more opportunity there is for your symptoms to emerge. Now, once those suboptimal pathways are set in place, it can be difficult to retrain them without expert medical help. Rest is not adequate health care to fix lingering brain dysfunction from a mild traumatic brain injury. But with a combination of physical therapy, cognitive therapy, diet and nutrition, and calming activities like meditation, those pathways can be significantly improved. Other causes of long-term symptoms. Certain post-concussion complications can result in long-term symptoms. Included in the blog is a list of other blog topics specifically referring to causes of long-term symptoms. Some of these are autonomic nervous system dysregulation or dysautonomia after a head injury, vestibular dysfunction after a concussion, vision issues after a traumatic brain injury, hormone dysfunction after a brain injury, and specific risks and complications that women in particular can face with concussions. When do symptoms of a concussion appear? When it comes to symptoms, everyone is different. Most people have symptoms immediately. Those symptoms might go away and come back, or new symptoms could appear a few days later. Below are the answers to a few commonly asked questions about when concussion symptoms appear and disappear. So first is, how long do symptoms of a concussion last? Well, how long symptoms stick around depends on the severity of the concussion, and it can also vary from person to person. Mental confusion at the time of the injury is the best predictor of long-lasting symptoms, meaning if you experience confusion and disorientation when injured, you're more likely to have symptoms that don't go away quickly. In general, symptoms of a concussion should resolve in 2 weeks. Some people have symptoms for longer, even up to 3 months. Concussive symptoms typically resolve in 7 to 10 days or within 3 months. If symptoms don't resolve after 3 months, they probably won't go away without therapy. The above guidelines hold true roughly for 80% of the population, although this number does fluctuate in any given study. But the remaining 20% or so take longer to recover than most people, or might not see their symptoms go away at all. In an article published in JAMA Neurology, the authors state that many concussive patients experience the evolution of symptoms 5 years after MTBI, and not the resolution of symptoms. 72% of patients had worsening global disability after those 5 years. This clearly evidences that chronic concussion symptoms are likely to progress over time, and if you do have these symptoms, you're not in the miserable minority, but potentially the majority. Recovery time isn't correlated with the injury source. So someone who has a concussion from a car accident, for example, is likely to need the same recovery time as someone with a concussion in sports, such as football or even snowboarding. In general, if your symptoms haven't gone away after 2 weeks, it's time to look for treatment alternatives. And if it's been 3 months, you need to find a provider specializing in post-concussion syndrome treatment. If that does sound like you, we offer a complimentary consultation to patients who would like to determine their eligibility for our post-concussion treatment. Next question is, can symptoms of a concussion come and go? The answer is yes. Symptoms of a concussion can come and go and often do. Some patients feel great after their initial recovery. Then a few days or weeks later, those symptoms can return with ferocity. And why is this? Well, it may be that your brain is still using suboptimal pathways to relay information and oxygen. When your symptoms are gone, that means your brain is still doing a pretty good job of compensating. But when symptoms return weeks, months, or even years later, it's often because of some other stressor, maybe another injury, another concussion, an illness, emotional trauma, extra stress at work. But it's too difficult for the brain to handle. Next question is, can symptoms of a concussion be delayed? And the answer, yes. Symptoms of a concussion can be delayed. Some patients don't feel any negative effects from their concussion, or they might have a few symptoms that might resolve, maybe like headaches, followed by new symptoms like irritability or anxiety. Now, remember those suboptimal pathways? The changes might not be severe enough for you to notice at first, but sometimes it's the start of a downward spiral. In these cases, when a certain section of the brain doesn't receive enough oxygen, its ability to signal for more oxygen is negatively impacted. And then over time, the reduced oxygen and signaling can make each other worse. Eventually, that negative loop increases enough for you to notice the symptoms. For example, you might have had no problems with vision immediately after a concussion, but a few weeks to a few months later, you might discover that your peripheral vision is disappearing. That negative cycle of oxygen insufficiency and reduced signaling could be why. Concussion recovery. Which doctors to see and when? If you experience trauma to the brain, watch out for the emergency symptoms that we listed above. If any of those symptoms emerge, visit a hospital immediately. They might have you undergo a CT or an MRI scan to make sure there's no other damage to your brain. Now, just be clear, unfortunately, MRI and CT scans cannot prove the existence of a concussion, but they can at least rule out other injuries such as skull fracture or brain bleed. Step 1, visit a head injury doctor. If you're showing signs of a concussion, it's a good idea to see a healthcare professional soon after the injury. As long as you're not showing any signs of an emergency, it's your choice whether to go the same day or to book an appointment for the next day or two. When you do seek a healthcare provider, look for a head injury doctor, such as a physical medicine and rehabilitation physician or PM&R doctor. They're also called physiatrists. You may want to see a sports medicine practitioner, experienced with concussion treatment, or someone at a really good concussion clinic. If you're in the Salt Lake City, Utah area, we recommend Neural Effects for acute concussion treatment. Now, while many concussions fully resolve on their own, some don't. And either way, you can speed up your recovery time by following a good recovery plan. Step 2, rest for no more than 24 to 48 hours. Whether or not you visit a physician, follow a pretty strict 24 to 48 hour rest period. Try to avoid all over-the-counter medications, except maybe Tylenol or acetaminophen during this time. Now, this is because NSAIDs, or non-steroidal anti-inflammatory drugs, such as ibuprofen, Aleve, and Advil, could exacerbate bleeding in the brain if you have it. Step 3, gradual return to normal activities and exercise. After the 24 to 48 hour rest period, you can gradually increase cognitive and physical activity, but make sure to do exercise that is safe after a concussion. If you play contact sports, do not resume practice until you're fully healed. Athletes are especially at risk for something called second impact syndrome, or SIS, which is a life-threatening condition that can develop when they sustain another concussion before the first one is healed. That said, developing SIS, or second impact syndrome, is not limited only to concussion in sports. Avoid any activity that could result in a concussion. Give yourself 2 weeks for symptoms to resolve as you pursue a gradual return to work or school. If they don't, we highly recommend visiting a concussion treatment provider. Step number 4, start therapy. If the signs of a concussion are still present after 2 weeks, it's time to get a professional involved. Post-concussion syndrome, or PCS, can come from even a mild concussion. In most cases, PCS will not resolve on its own. Many, but not all, PCS patients have had repeat concussions. Targeted physical and cognitive therapy can make a huge difference in outcomes. Read more in our blog about therapy options for ongoing symptoms, or visit these posts specifically about therapy types. And these include vestibular therapy for concussion, physical therapy for concussion, cognitive therapy for concussion, and speech therapy for concussion. Thank you again for listening to this audio blog. And if this resonates with you at any level, please feel free to reach out to us for a complimentary consultation and see if getting treatment is right for you.